Good morning, good afternoon, good evening. Thank you to the SIPA Satellite Meeting Committee for inviting me to present my study on the detailed evaluation of the measurement of drug block kinetics on an automated patch clamp system. As many of you will be familiar with, the Milnes protocol was designed in order to assess the potency and kinetics of drug block in hERG channels. While a number of manual patch studies have been published, no detailed assessment has been done in a high throughput automated patch clamp system. In panel A here is a schematic representing the voltage protocol known as the Milnes protocol. It has a 0 millivolt step and is held at -80 millivolts between protocol applications. These protocols are run in a sequence of repetitions in control conditions, followed by channels being held in the closed configuration, allowing for drug equilibration, such that when the protocol is again initiated, we can directly see the onset of drug block and following drug equilibrium in the channel. This is an example of a typical currents produced from this protocol. Here we have a control current, the first drug onset current, and the final drug response. From these channel currents, we can subtract the control from the drug onset and measure the percent block over time, fitting this data directly with a single exponential curve, which gives us a time constant value, which I'll be referring to as tau on. Now, as I said, a number of studies have been published from this protocol in a manual patch clamp setting. However, we set about to test this in a high throughput system. We selected the SynchroPatch 384PE, the full whole plate configuration. Recordings were made at ambient temperature with CHO cells stably expressing hERG channels. Now, the manual dataset, which has been recorded at ambient temperature and previously been published, we will be comparing our datasets to. This is the percentage block data for each of the 12 SIPA test panel drugs. This second panel is also directly from the previously published paper, which shows the time constant values for each of the 12 drugs at multiple concentrations. There were a number of these drugs with kinetics of block which were too slow to be accurately measured at the protocol lengths used in this study. And there were also a number of drugs for which the time course of block was too rapid to be accurately measured. Therefore, we selected the 4 drugs for the high throughput study that exhibited dose-dependent responses for the kinetics of block in the original manual patch clamp study. For the high throughput study, we used 5 or 10 sweep repetitions for experimental recordings, and the protocols were either 10 or 40-second length hERG current recordings, according to the time course of drug block. We developed an in-house software package to streamline quality control and analysis, and the quality control measures were based on previous manual recordings. This table represents the quality control parameters that were applied in this study, and they can be broken into several sections. The initial section are the quality control measures, which relate to the cell and patch quality. The following 2 parameters are relevant to the hERG channel current produced by this protocol, followed by the analysis quality controls, which relate to the potency or percentage block, and the kinetics, which were measured by fitting exponential curves to the data. However, there was one major roadblock which was needed to be overcome before we could further complete this study, and that was related to the leak correction applied to the currents. It was found fairly early on that this protocol is very sensitive to leak correction. This data represents typical leak uncorrected data. And if we zoom in on this initial portion here, we can see this is in gray is the protocol overlaid on the data. And this little step down here is the leak correction step. It's a 100 millisecond step to -90, which is added to allow us to measure the leak current. And this is the current that's not due to potassium ions passing through the Herg channel. And what we found using the system online correction, as well as correction after the fact, that the leak correction was poor, and it made the currents appear falsely unstable. And again, zooming in on this initial portion here, in pink, you can see that the current has been overcorrected here. And the amount of noise shown here shows that the step is really too short to adequately measure the leak current and then use to correct these measurements. And the issue becomes even more of a problem when we do the current subtraction, and these drug onset responses become very difficult to fit. So this inbuilt leak correction is really insufficient for this data, and this would be the case irrespective of the platform used. To make this data usable, we looked at using part of the 0 millivolt step to leak correct our data. And so the currents appeared more stable when we use this as the correction. So we use the very initial portion of the 0 millivolt step where we have no current from the Herg channel yet passing through, such that we can use this to measure only the leak current. And what we saw in blue, you can see that the current is quite well corrected. And when we do the subtractions, we saw a great reduction in noise at the beginning of these subtracted traces. And we're able to much more adequately fit the data. Now, as a caution, this type of workaround will only work when the onset of current is adequately slow. So going forward, longer leak steps are really necessary, particularly with relevance to physiological temperature data recording. So now we've overcome the leak correction issues, we were able to assess the quality control parameters and the effect that they had on the data efficiency. So here we've plotted the data retained from 8 to 11 plates, following the quality control measures which were applied for 5 and 10 sweep repetitions. We then split this plot up into 10-second and 40-second sweeps of either 5 and 10 sweep repetitions. And ultimately, we can see that the longer the total protocol, the greater the loss of data. And I would particularly like to highlight the stability parameter here, where you can see one of the most significant losses of data, which I will talk further about in a few slides. But ultimately, the data loss due to quality control measures was considerable, with the 10-sweep progression of 40-second sweep protocols exhibiting the most significant levels of data loss, with less than 2% of data remaining. As a reference, typical potency-only protocols would likely sit around the 70% or greater data retained. So we do see a lot less data here than what we would with potency-only protocols. So now to look at the results. We wanted to see whether 5 or 10 sweep repetitions experiments would significantly alter the data that we were able to record. So here we are looking at the potency or the percentage block for each of the 4 different drugs at 3 different concentrations, comparing the 5 sweep or 10 sweep repetitions. Furthermore, we looked at the time course of block responses for each of the 4 drugs at 3 concentrations, comparing 5 and 10 sweeps. And ultimately, there was no statistical differences found between 5 or 10 sweeps for each of the drugs at each concentration. So going forward, we chose to use only 5 sweep repetitions for the data analysis. As I mentioned a few slides earlier, the control stability parameter caused one of the most significant levels of data loss in the quality control. So rather than using a 10% control stability parameter, we looked at reducing the threshold to 20% control stability. We compared the results of percentage block for each of the 4 drugs. And we also looked at the time course of drug block, and we saw that for each concentration of each drug, there was no significant differences whether we use 10 or 20% for the control stability parameter. We obtained more data with 20%. The data wasn't different, but we saw a greater degree of variability within the data, such that going forward, we decided to maintain the 10% control stability parameter. So finally, comparing this finalized high throughput data set to the manual data set for potency for each of the 4 drugs at 3 different concentrations, we see that there are several instances where we see significant changes and variations from the manual patch clamp data. Furthermore, in comparison of the time course drug block data, we also see similar differences for at least 1 drug concentration for each of the 4 drugs. If we compare the concentration response curves, we can calculate the IC50 values for each of these drugs, and we see for 2 of the drugs quite modest shifts, which would be typical of most potency-only drug protocols. And for 2 of the drugs, we see a more significant shift. However, if we look particularly at tafenidine, we do see a quite significant change in the hill slope measured here. And this is particularly most likely a result of the insufficient length of the protocol used for this data set, which I'll go into in a moment. The other thing we had the opportunity to do is compare the results from another automated patch clamp system, the Cytopatch, which was previously published. And essentially what we see is that even though we don't have as many concentrations to compare here, that the Cytopatch data does vary significantly in many cases in respect with potency and time course of block for each of these responses. So we're likely to see this variability, whatever platform we're looking at. So typically, the percentage block tends to be less variable than the time course of block measurements. And the sources of this variability, particularly for the time course measurement, is twofold. One, the total experimental length, and two, the length of the protocol itself. This figure is taken from the manual patch clamp dataset publication. And it shows cisapride being measured with a protocol of insufficient length. This is a 10-second protocol, and you can see that onset of drug block does not reach equilibrium within that 10-second time period, such that when the subtraction's done, we're essentially fitting a straight line, and the data is incredibly variable. However, as we increase this sweep duration, we see that once we get up to about 40 seconds, we see that the data is much less variable, and we're able to get a good measurement of the time course of block. This is a plot of the manual patch data compared with Syncropatch and Cytopatch data. And what we see is this is plot against the coefficient of variation. And this is the time constant measured divided by the total sweep length. And essentially what we see is that the closer these two values, the greater the variation observed, such that a protocol length of at least 3 times the time constant is required for reliable measurements of the data. And that would be our recommendation going forward. So in conclusion, this study details the transfer of the Milne's protocol from a manual to a high throughput automated patch clamp platform. The protocol was successfully run. The percentage block data is reasonable, although other protocols may be preferred for this. Measurement of drug block kinetics are more challenging, however. They are variable, more quality controls are required, and the results are distinct from manual data sets. And these results suggest that significant challenges and considerations do exist in relation to the application of this protocol in a high throughput preclinical screening assay. So where do we go from here? We have a number of options. Firstly, to first pass screen the kinetics to eliminate those with exceptionally fast and slow kinetics, essentially those that are particularly hard to measure. Next, using a Milne's or an alternative protocol to assess the kinetics of the remaining drugs more closely. Thirdly, it is essential to ensure that the protocols are of sufficient length such that drug equilibrium is reached within the first sweep, or 3 times the time constant value, but no longer than required. And finally, using the kinetic data for modeling where appropriate. Finally, I would like to acknowledge a number of people, particularly Jessica Farr, who was instrumental in the development of the software, and my host laboratory. Thank you very much for your attention.